Right, guys, welcome back to the Adam Peeler Fitness Podcast. Today on the show, I have an exciting new addition to the Adam Peeler Fitness team. So just as a recap of, or I guess a preface of this conversation, it's always been a big goal of mine to have a performance rehabilitation division of my coaching business. I think that's something that's really, really important to be able to have somebody who is qualified, who is up to date with current research and best practices with the rehabilitation setting, specifically for people that are weightlifters, who are powerlifters, who are bodybuilders, because most of the time, if you go to a physical therapist, they are generalists. They are not really going to be equipped to necessarily help you through your pain. They don't really understand why do you want to keep squatting, benching, deadlifting. Like when they say, well, just don't do that. Like they're not wrong. They're doing no harm. But it obviously, for our purposes as lifting junkies, that is not ideal to our mental health, or really just it paints a narrative that is not exactly correct, because there are ways to go about the rehabilitation process so that you can not only come back to your full function and as strong as you once were, but be able to continue training for life and moving without pain. So Kevin has just graduated from Western Michigan University with his doctorate of physical therapy. And he is a lifter himself. So he understands a lot about, and that's important. I think when you go to any clinician is do they lift weights to be kind of understanding what you're going through. Because that ability to have empathy is a huge part of being a practitioner, and actually understanding things. So, Kevin is now officially a part of the Adam Peeler Fitness Rehabilitation division. He is the head of it. All of my current clients do have the ability to access Kevin for a free one-off consult to talk about any sort of pain provocation that they may have. I'll refer out, and then Kevin will kind of just serve as the confidential intermediates to kind of discuss, hey, this is like what I think about XYZ situation. This is how we should manage it. And then I'm kind of in that and going back and forth between me, Kevin, the client, and we're kind of just, going to progress the entire time for you to be, fully functional. So that was kind of a long preamble, but I guess I'll let Kevin talk and say anything about himself that I didn't already say.
No, I think that was a good introduction, and yeah, stoked to be on the podcast, stoked to be on the team, and to be able to serve all of you guys listening to this potentially, and then all of the clients that are listening to this that are currently getting coached by Adam. Yeah, I agree with everything you said. Like, I think it's extremely important, especially as clinicians, and it's why I do the work that I do, that not enough therapists, not enough physios, not enough chiros, actually understand the needs of athletes in general, but especially lifters, and the unique demands of the sport and the unique demands of training. So that is why I ultimately do what I do. And yeah, I'm excited to be here and to have this conversation and to kind of chat on all things rehab, pain, and talk about what things they need to keep in mind when it comes to pain and rehab in the training process.
Great. So the whole point of this podcast essentially is just to provide some upfront value for you guys for free, just to kind of just help you guys out, since that's always been, anybody who knows my brand knows I'm all about giving high quality evidence-based information out for free, as much as we possibly can. I'm not just going to say, hey, this is the service I have, bye. I don't think that's a compelling sales pitch or a compelling reason why should I even get help. Because I think that's actually a big question. Like, a lot of people are like, why should I even get help? Whatever. How do I even respond to this? So I kind of just want to talk back and forth with Kevin about how we should kind of just respond to pain and training. Say that you go into the gym, you have squats, you start warming up, and you feel a tweak in your around your knee, your knees start to hurt, and you, as somebody who's not familiar with pain and what it means, start to freak out. What would be, Kevin, if you had somebody who presented you with patellar tendinopathy, symptoms. Say they were going down in the squat and they, once they got past a certain point, say it's just right past parallel, they start having a lot of distal pain on their patellar tendon. What would you advise? First off, how should somebody respond immediately from a psychological perspective? Because the knee-jerk reaction of most folks is to say, "Oh, pain, red alert." Like if you guys have seen the Inside Out, where like he sees girl and like it's like girl, girl, and they're all freaking out inside of his brain. That's what most people think when they see pain.
Yeah.
What does that pain actually mean? How should we respond to that first off? Because that's the number one thing.
Yeah, I agree from the standpoint of like, I think the first thing to understand is like what actually is pain, like why are we feeling this, what does it actually mean? Because I think the mistake that a lot of lifters, especially and just people in general, make is the moment they feel some sort of pain, ache, or twinge with movement, and in this case like your knees hurting or clicking when during the squat, for example, you end up wanting to immediately, well, we like to call in the rehab space catastrophize, or have unneeded stress or worry about what's going on. And not to say that your stress or worry about, oh my God, like my knee is like screwed up, like is unwarranted, because it is warranted. Like it's understandable why you're having those feelings. But I think the thing to understand first and foremost is what that indicates and what that doesn't, right? So in a nutshell, we can think of pain essentially as like our body's alarm system, right? Where it's simply a survival mechanism that we've developed through the years that helps to tell our brain that something is off. Now, whether something is truly off or not is what's to be debated with this whole subject. But the standpoint is that we're just having this as a protective mechanism, right? The key thing to understand is just because we're having pain doesn't mean we have any actual tissue damage or injury to that structure associated with it. Meaning, in not all cases does pain mean that we are having a direct owie to that tendon, ligament, or bone or whatever, and that something is actually wrong. In some cases, it can be, but I think the thing to understand is that you don't know if that's the case or not, nor does it actually matter in the first interim moment that that actually occurs. So the big thing is when you are training and you have some sort of owie or pain in the gym and like that happens, the first thing to do is not freak out about it, because freaking out about it actually makes things worse from a pain psychological standpoint. Not going to dive into the weeds here with it, but in a nutshell, when you start to freak out or worry about that pain that is going on, we're just further catastrophizing over that, sending unneeded signals psychologically to our brain that just reinforces that connection. As a result of that, we get increased pain signaling going on, central sensitization as it's called, and as a result, we get more and more of that alarm stimulus going on. I always like to tell patients and clients, it's very similar to, again, our brain having that alarm system of pain. It's very similar to having a smoke alarm in your house. And I think we've all had experience with like very faulty smoke alarms where you'll be cooking like a steak or something, and then like there's just some steam going into the air, and then an alarm system just ends up going off like crazy multiple times during the night while you're just trying to cook up a meal for you and your wife or whatever, right? And that doesn't mean that there's a fire going on, but it's just super sensitive at that current point in time. Conversely, you could actually have a fire going on and that smoke detector saves your life. Point being, that's what pain is. Pain's just that smoke alarm. Sometimes it can actually mean something, like something is actually wrong. A lot of other times, it can also just mean it's super sensitive and nothing's actually wrong, so you don't need to stress or worry about it. That's like step one. Like, understand what it is telling you, don't freak out about it, and then we'll kind of dive into what to do from there. But I'll let Adam kind of chime in with things.
Yeah, something that I like to compare it to is it's just like if you're training really hard. When you are literally training, you're causing like micro trauma to your muscles. You're literally causing micro tears in them. That's a part of the process. And anybody who's approached RPE 10 or failure understands that it gets increasingly more quote unquote painful. Does that necessarily mean that something's wrong? No, it just means that you're stressing your physiology. And that pain is a biofeedback mechanism that's just saying, like, look, be careful, like, or you're pushing yourself towards, something that's probably a little bit less comfortable for our bodies, or a little bit less safe. And so I think what Kevin just said about first off, just gather yourself, take a step back, talk yourself down, XYZ, just do whatever you have to do. So first off, that's the first thing, just recognize does not necessarily mean that anything is wrong. Outside any obvious structural deformity, there could be a number of reasons why you're experiencing that pain. Kevin already outlined all those. So I'll kind of just go into what I would view as step two, which would be find the point of entry of, okay, so I'm experiencing some pain. And what that basically would mean if we're going to find a point of entry, say we're doing a squat, for example.
Mhm.
If try, maybe you start doing, you're doing a normal tempo squat and you're trying to go down, and that's causing you some pain, it's causing it to be uncomfortable. Okay, we do all that is information. Again, don't freak out. How about we control the eccentric? How about we do a pause squat above parallel? Is there pain there? The answer is no. Okay, maybe that's where we progress from, and then we'll slowly overload and kind of come back to that. Or maybe sometimes it's you do have that pain with any sort of squat pattern, even like a high pin squat. Maybe you do a lunge, the dumbbell Bulgarian split squat, a leg press. Because the reason why it's important is because lots of times people will just say, pain, I'm just going to just walk away. The problem with that is it's like going into the gym without like having any sort of program. You have no point of reference about, okay, well, like, how do I progress from here? Because essentially rehabilitation is progressive loading. The same thing that you're doing with weight training. And you're going to add weight to the bar or add, harder variations that are more demanding of your body's tissues as your body's adapt within your own adaptive capacity. Because just like with training, just because you're trying harder to get better at rehab doesn't mean that you're going to get better with all of a sudden. And then there are also going to be ups and downs of the rehab process, where someday maybe doing that pause squat above parallel does hurt. That's okay. You just have to kind of find like regressions. This is why you need to have somebody who knows what they're doing that can help outline that process and provide that emotional support and social support. So I'll let Kevin kind of go off of that. So like if you had somebody who they didn't do that, or they like, what would say, okay, so just they've experienced pain, they have not freaked out, what is the next step?
Yeah, I think it's going to be a lot of what you like kind of summarized earlier, and I'll kind of add on to it by like, like what what I'm about to say is essentially like a multi-step framework. I like to think about it in terms of a system that I like to use with patients and clients, in terms of like, for example, if we're going to use the same example here of like the squat and then getting knee pain when you're getting past parallel, now that you've kind of settled down, not freaked out, like what do you actually do from there? Like Adam said earlier, you're going to need to find your entry point and loading. And this is a like 3-4 step framework that I like to use when it comes to actually finding that entry point and loading. Option number one that I like to look at first is there a load that you can decrease that overall weight by that still allows you to squat through the entire range of motion with no more than a 3 out of 10 pain. Maybe you're getting that pain like at the front of your knee when you're getting down past parallel into the hole, and that only occurs when you get past 185 pounds. But as soon as it's at 185 pounds or less, you don't get that pain going through the full range of motion. Cool. That's going to be your entry point to loading. So the first thing I always like to adjust, modify, and look at is absolute loading on the bar. Like, is there a weight that we can decrease by that allows us to still train productively through a full range of motion with very little to no pain, 3 out of 10 being that limit? That's going to be your initial entry point. That's where you're going to progressively ramp back up to over the coming weeks. The key is to not do that quickly. You need to just gradually expose yourself to those demands and slowly work your way back up over the coming weeks. Now, let's say you tried doing that, or the lifter tried doing that in this example, and no matter what, they're still getting pain. No matter what load they're decreasing it by, they try to slow down tempo, everything like that. No, they're still getting pain when they're going through that range of motion, no matter what, regardless of the load. Well, the next thing I like to look at is in step 2, can we adjust the range of motion? From there, like Adam said, you would maybe try like a box squat or like a pin squat above parallel at some joint angle that doesn't seem to cause you as much discomfort. Again, no more than a 3 out of 10 pain. That becomes step 2 of our entry point to loading if we can't accomplish step 1. That's going to be your starting point. The goal from there over the next coming weeks will just be to progressively increase your range of motion, get deeper down, decrease the box height, decrease the pin height, and eventually work your way back to doing full parallel or ass to grass squats and continuing to progress from there. Now, let's say in the case of this lifter, or you, for example, if you're dealing with this right now, you're also still having pain during step 2, and it doesn't even matter where you try to adjust the range of motion. You're still having pain no matter what at the front of your knee, and it doesn't even matter. Cool. Well, then we move on to step 3, which is what is the closest exercise modification and variation that we can make that is most similar to the current movement that is aggravating us. In the case of this squat, let's say you squat low bar and you're having pain at your knee, and no matter what load you do, no matter what range of motion you do, you're still getting pain at your knee there. And we can't accomplish step 1, we can't accomplish step 2. Well, then with step 3, maybe we change that low bar to a high bar by changing the biomechanical angle. Maybe that seems to help things. Maybe that doesn't. If that doesn't, cool. What is the next closest variation that we can do? Maybe we can play around with a more hip dominant squat. Maybe we can shift to like more of like a safety bar squat and do something like that that still allows us to train productively through a full range of motion or shorten range of motion with no pain. If that doesn't work, we go to the next closest exercise variation. Maybe we can try, like, instead just going to what Adam said, for example, like a Bulgarian split squat that's more hip dominant, or maybe we can go to like a reverse lunge where we're getting less knee flexion travel, or maybe we can go to some sort of reverse tap down where we can still productively train those structures and your quads without getting all of that biomechanical force loaded onto the knee and that anterior motion there. The goal of step 3, if we can't accomplish step 1 and 2, is simply what is the closest exercise variation that I can productively train with no more than a 3 out of 10 pain. And then the goal still stands as let's now move closer to the primary exercise variation over the coming weeks and months, and then from there slowly gradually expose ourselves back to the original movement and the original loads over time. And that's essentially just a quick 3-step framework that you can kind of work through, adjusting load first and tempo, going to range of motion, and then going to exercise variation if you're having pain, for example in this example with pain at your knee during squatting, or with like literally any lift and any painful body part that you're having. Like the same framework still stands. It just needs to get adjusted to what you're currently having difficulty with.
And sometimes it could even be something as small as just changing like your stance with, or like your grip with on like a bench press or something like that. Because like I've dealt with on off elbow and shoulder pain in bench press, and it's kind of like, I can, it's like a 3 out of 10 pain when I do pull stroke, and I can still do more or less the same load as my actual wide grip, but for whatever reason that joint angle just is a little bit better. So kind of what Kevin said, that's going to be step 2. So basically there's just going to be exercise selection and regressions. The other one after that is just going to basically be a progression and expectation management from the process, from finding that entry points. And I already did address this, but essentially after you get to that entry point, obviously the goal is going to be to actually return to that activity that you wanted to do. Say it was low bar back squat without pain, with whatever load that was that started to present with pain. So Kevin, how would you progress somebody? Say that they, for in this example, say they was, say they were really in deep with that knee pain, they had to go all the way back to a Bulgarian split squat. Mm-hmm. How would you progress them? How would you outline the process of that so they have appropriate expectations?
Yeah, I'd say something that I commonly struggle with, or I wouldn't say struggle with, but more so that our clients and patients struggle with, and something I always have to have a conversation on, is exactly this. Like, what are the expectations and how quickly they can get back to their desired activity? And I think a lot of people, obviously, we live in the day and age where we want to get stuff done like as quick as possible. And I think a lot of people have the expectation that their pain is this much, they're this regressed, but they can get back from Bulgarian split squatting with a 5 out of 10 pain to low bar squatting like 405 with no pain in like the span of like 4 weeks. And what I have to say is, like, can we decrease pain like relatively well in like 4 weeks? Absolutely. 4 to 6 weeks is typically like what we can see for a lot of acute stuff. Now, the thing is, when it comes to actually getting back to performance, that's a whole different story, because the goal with performance is not just do we not have pain, but are we adapted enough to be able to handle those stressors or loads in the first place? Because if we don't ensure that happens, we run into the same, as I like to say, chronic pain injury cycle that a lot of people run into, where they ramp themselves back up too quickly, don't have these proper expectations set, and then they are not yet adapted to those loads yet. Their structures are not yet adapted, and their tissues are not yet adapted. They go right back to squatting in that same manner, and then end up overflowing their cup of recovering capacity essentially, and re-injuring themselves again. So the goal and the thing to keep in mind is, this is not a 4-week process. This is not a 6-week process. This is obviously going to depend on what structure is injured, what the injury was, or even if it wasn't an injury, just what the pain currently is at, and like the process in getting that. That's all going to differ person to person. But in general, like, you're going to be looking at, like, at a minimum, a lot of times, like 8 weeks to like get back to baseline. And a lot of patients and clients I work with, like, we're looking at like 12 weeks, 16 weeks, 24 weeks, even to like get ourselves performance wise back to where we need to be. We can get pain controlled very quickly, and that framework essentially is going to look like, again, starting with the lowest entry point or the earliest entry point we can. A lot of times, if pain's really high, we're doing a lot of isometric work and stuff to begin with, just for an analgesic effect, to calm pain down, to restore things, to then get into eccentric focus work, isotonic focus work, and gradually work our way back up that progression tree, if you will. But that process is a multi-week, multi-month process. Like, that can take us 4 months up to 6 months, a lot of cases, especially if it's something that you've been dealing with for quite some time. Because we also have to delineate, is this something acute that happened and we got behind the 8 ball super quickly on this? Or in a lot of cases, they get injured, they don't reach out for help, they try to do this themselves and don't really know what they're doing with it. And then as a result of it, end up actually getting behind the 8 ball a little bit and kind of delaying a little bit of that healing time and progression time that could have otherwise been done. And then that turns into chronic pain, right? From acute to chronic, timeline wise, and that ends up coming with a whole host of other factors that then kind of pushes our recovery timeline a bit longer than what we probably like. So I think the key thing here to understand is, hey, like, just like training, you're not going to get your 315 bench or whatever you're trying to do in like 4 to 6 weeks. Like, you didn't get strong in like 4 to 6 weeks, right? It probably took you months and multiple like mesocycles. You're also not going to get over this pain and get back to performance within a mesocycle, within 4 weeks, within 6 weeks. It took you all that time to gain that capacity. It's going to take you a lot of that time to regain that capacity as well. A little shorter, because obviously stuff comes quicker, but when we're dealing with rehab, we also have to respect recovery timelines. So it's going to take relatively just as long, maybe a little shorter, to regain that capacity that we lost in the first place.
And just like with training, because this is not in your control in terms of how fast your body adapts, it's about just creating the optimal environment for that recovery process, for the adaptation to occur. Because if you are experiencing pain or whatever, even if there's nothing structurally wrong, well, you might just have some time that has to be done in order for your brain's nervous system to, cancel that biofeedback for whatever reason. And that's frustrating to hear for a lot of people. It's like, wait, you're telling me like I'm feeling something, but I'm not feeling something at the same time. It's like, well, kind of, but sort of no. Like, again, like what Kevin said, it could be just really just be a sign of like, hey, maybe the stress that we've been doing, because like, say you're in a power lifter, you're in your last few weeks of your block before a meet, your loads are the highest, your cumulative fatigue from your training block is also the highest. You might have some pain in your knee, just because you're doing a lot of heavy loading on that. Stress levels are high, and this is your body's way of saying, hey, take it easy here. These are getting kind of tough. This is also why it's important to talk to your coach or whatever about what you are experiencing. A lot of lifters, if they are experiencing any sort of pain or discomfort, don't talk about it, or they'll be like, oh, I'm not going to talk about it with my coach, not going to point it out, and they'll try to be a hero, and then the coach doesn't know anything about what they're going out with. And maybe all they have to do in order to get you to the platform healthy is lower down the relative intensity. So instead of pushing an RPE 8 as a single, maybe you're doing like a 6 to 7, and that keeps you safe, keeps you healthy, and you can still have some decent like idea of what you could do for single at the meet. at least have a very conservative estimate, and you can go off of the day. But yeah, it's just you know, you can't force your body to adapt. And the worst thing that you can do actually, for just, and again, there's so many parallels between rehabilitation and just actual good structured progressive training. You have to train within your body's current capacity to have that overload. If you're not able to recover and adapt to the rehabilitation stimulus, for the tissues to remodel, to have positive expectations, to have positive biofeedback, whatever, you're not going to really go anywhere. You're gonna, it's kind of like it's kind of like, it's impressive if you have the discipline to bang your head against a wall for 5 minutes. It's not going to positively adapt to you, though. I mean, you're trying really hard. You're disciplined to do that, but it's not really going to get you anywhere. So I think that's something that's really good to just keep in mind. So essentially, you know, just how as my framework. So you know, you're obviously going to have regressions in exercise and progressions from the Bulgarian split squat. So maybe you're doing like, you know, body weight only. Maybe you're going there. We're going to try to add some load. Then we'll go to, you know, a front squat, then a high bar squat, then a low bar squat, full flexion, you know, and then, you know, maybe that's when it happens. And however long it takes is however long it takes. And you should also be aware that just like with training, there will be good days and there will be quote unquote bad days where you're not going to feel as good, where pain will be a little bit higher. Doesn't mean the process doesn't mean that this isn't working. It just means that this is the normal process of ups and downs as a not a closed system, as a complex organism that has several things that impact, you know, like maybe one day you're going in, you have a bad day and you're just like have a terrible mindset. You don't really want to squat. You don't really want to do the work. You might have some more pain. It's just a part of the process. The key is, one, this is why it's important to have that support with a coach or with a rehabilitation specialist, so you actually understand this, who can help keep you on track and say this is okay. You know, we're going to keep going forward and trust the process. Now, if you're starting to have, you know, more and more pain recurring with that current variation, well, what do? We go back to regressions. Okay, that's fine. You know, we may load it a little bit too fast. This, for whatever reason, is a little bit beyond your tissue's capacity. Let's go back to what we're doing one regression before and whatever. And when Kevin gives people his plans, a lot of it is going to be just a program like this with, you know, we're going to linearly like progress from this loading range, to this tempo, this variation, whatever. And sometimes the reason why Kevin says it might take a long time is because sometimes you might have like 2 weeks where you're doing just Bulgarian split squats, and you're doing front squats, you're doing slow eccentric high bar squats with a pause, and then slow eccentric high bar squats, and just high bar squats, then low bar squat. And that's going to take some time. So just, but if you're really devoted to this, you're going to commit to it and be okay with the ups and downs of the rehab process. One of my friends, he's one of the top 220 lifters. His name is Jad Alme. He tore his adductor. It was a grade 3 strain at his meet, trying to just squat just under 700 pounds, and he had to take a long time. It's now December. It was March. 9 months later, because he trusted the process, he got help, and he was smart about how he went about things. He's now blowing past his own numbers. And if you were to ask Jad, he would say that the process was frustrating and he had to be very, very patient. But that should be some sign that if you're really into this and you're a lifter for life, you will commit to the whole process of rehab and getting better. So I guess that's kind of a general bird's eye overview of how the rehab process works and whatnot. So now all of these things that we've said are things that you can do on your own. However, there is an advantage to getting help and whatnot. And so, Kevin, when should somebody seek assistance? Because I do think that you and I both have the idea of, you probably should try going through this on your own. But if you're having this like problem, like kind of coming up with things, this is kind of nuanced. Like, when do you get help? When should you get help, and who should you get help from?
Yeah, I have a couple different samples of this. I think in general, I think you can absolutely try doing this on your own, and you should. I think in general, with most things that acutely happen, like, give it anywhere from 3 to 4 weeks generally. You can even just say 2 to 4, but I like to say 3 to 4. And like if within those 4 weeks, like you're not seeing any improvements in like pain or symptom levels, or even if you do see improvements in pain and symptom levels, but what commonly happens is you see some improvements, but then you kind of plateau out a little bit, and then you're still having pain with the primary movement, no matter what regressions and stuff you did. At that point, it would be worthwhile to seek professional counsel from the standpoint of you probably need a guided professional in your corner that actually understands the process you're trying to work through and can actually map out a process and program to actually work through from that standpoint. What I'll also say is, and this is something I make very clear in like the consultations that I do with both your team and with every other team that I'm associated with and partnered with, is that not everyone is going to be a perfect candidate for my programming, for our rehab coaching, or for any of that stuff, because not all pain's created equal and not all injuries are created equal. And there are some cases where, and this is where the conversation of when do you actually seek true in-person medical attention? And I think there are certain scenarios where that actually is important to distinctly realize, because I don't want to sit here and say like everything possible is like manageable remotely or manageable on your own, because there's absolutely cases where you should seek in-person medical attention. For example, if you are having knee pain, but then you notice over the course of like the next 2 weeks or so that things are progressively getting worse and are not either stabilizing or getting any better. There is like signs of infection, like redness, swelling, etc., in the area, neurological symptoms that are either traveling down the origin or site of pain, or anything of that nature. If you're having any of those symptoms, or like in the case of the knee, like instability that you notice with normal daily activities that seems to get worse, like those are all things, for example, that to me, if someone's telling me this, I'm like, hey, you should probably actually go see an ortho specialist or someone in person for this, and not try to do this on your own, and not even try to like work with me or someone else online through a coaching atmosphere with this. And this goes for like all things: knee, shoulder, back pain, especially if you're having like, bladder symptoms, neurological symptoms, radiating pain, like that sort of thing. A lot of that stuff you should absolutely just go in person and seek medical attention, go see your ortho and get that checked out. If you are not having those red flag symptoms, which 95% of the time you're not going to, especially if it's just gym injuries and gym aches and pains and things like that, then you can go through this process yourself, spend 2 to 4 weeks going through it. If things are not improving / are just staying stable and plateaued, get help from a professional like myself, like Adam, that actually understands this process, that can help work through it in your corner and guide you along that process. And even for some people that I talk to, I'm like, some people would rather just prefer someone step into the corner immediately. Like I have people that will call me up just to step into their corner immediately when things happen. And there's also absolutely nothing wrong with that if that's your preference, from the standpoint of having someone just to keep you in control and like calm you down and keep your emotions in check and stress levels in check, so you're not catastrophizing over this yourself as you're going through it. Because you can have all these random thoughts that kind of come up if you're going through it yourself, and we know how big a psychological aspect of pain is, and it can be helpful, especially at the start and the beginning, to have someone there who actually understands what you're going through and can counsel with you and help keep those psychological emotions like in check, because that's going to just help facilitate a better environment for healing and actually get you back to your lifts and get you back to performance and activity like much faster than if that wasn't the case.
Yeah, so I think that's all really good. So the reason why Kevin's just saying there's some things that you just have to go in person is because there are some special tests, there are certain procedures that you have to do for actually to not have malpractice. Like if Kevin was to get somebody who has some neurological symptoms, Kevin, as somebody who's responsible and understands the limitations of an online consultation or rehabilitation service, would say, hey, I don't have the necessary tools or the appropriate resources at this time to help you out with that. You should go into this in-person specialist. In general, for lifters, the best thing to do is try to find some sort of a sports orthopedist or rehabilitation specialist who is specialized, so that they can help you. Don't go to like some general like PT that just works with like some like geriatrics or, just general population, because you should seek specific help for your specific situation, because this is going to be more of a niche thing. And I guarantee you, if you just go to that PPT, one of the biggest frustrations that people have is they just told me to not lift. And they're not, again, like I said, they're not necessarily wrong. They're advising you, well, that's causing you pain. It's my job to like keep you safe. And because they may not be aware of your situation, or frankly, very empathetic of your goals, they're just going to say, just stop doing it. And you as a lifter don't want to hear that.
Yeah, that's the biggest thing, is like keeping in mind like what to actually look for if you're going to seek in-person attention. And I can't tell you how many consultant clients and patients I've worked with that come from other PTs, come from other chiros, and it's the same story of, well, they just have me rest, or they just have me do some low level like TheraBand, external rotations, or low level exercise, or bird
Yeah, you
dog.
can't dead dog your way back to 500-pound squat.
Yeah, it's like that's cool and on the beginning if we're trying to just calm pain down and stuff, but then it's like, what do now? Like, what do we actually have to do now? What are the other actual steps to get back to performance, which is what we just spent the last like half hour or so like talking about, is like what is the missing component and what you actually need to worry about and focus on. So yeah, and that's something we do too, for like when I'm seeing someone and I know I'm not the best fit for them on an online capacity. This is also why consulting with a professional that you trust is also important, because what I commonly will do if like I know I can't help this person in this remote coaching atmosphere is actually help find them a person in person that actually understands their sport and understands what they need, because we as professionals have our connections, we have our network, we know people like across like the country. So it's like we can very easily set yourself up with a referral or with someone we know and trust that actually understands your sport and actually understands the demands of it, because that's super important. If you are going to see whether someone online like myself, or if you're going to see someone in person, to actually get like in-person treatment for this.
Mhm. Yeah, well, one of the biggest advantages of the online rehabilitation, we've already kind of covered along, well, that's the biggest advantage of online. Basically, more specialized, situations need more specialized help and in-person tests and et cetera, like MRIs, like whatever. Online is a great thing to do it because, one, it helps establish self-efficacy during the rehabilitation process, which is huge. One of the biggest goals is not to have you be reliant upon a rehabilitation specialist or having to go to somebody in person in order to have your needs met. Being able to learn exactly, because Kevin's goal in his consultation is not going to be have every single time that you have some weird ache or pain, is to say I need to pay X amount of money to go and get help. This is why we're also applying this so that lots of people can just get help and have some more self-efficacy and actually understand, like, when is the performance rehabilitation service like for me. And if you want to have more help, you want to have that emotional support, understand things more for your current situation, because these are just generalities. Kevin will be providing a much more in-depth, comprehensive service than we are going to be able to provide on this podcast. But essentially, what's most important is that you establish some self-efficacy. You understand how to troubleshoot things. You understand how to respond to pain and training. You understand the process of it. You're going to have appropriate expectations so that you can actually progress back to normal. And then another just thing about it is that, especially for current clients right now, the reality is that at some point in your lifting career, you will have some minor ache, tweak, pain, niggle. It's going to happen. You are lifting weights, you're challenging your physiology. It is a part of the barbell sport. And you know what, if you are, even if you're just general population person, like, things happen. Things
It's
happen.
just part of the human
It's part of
experience.
it.
Like, you're
Exactly.
gonna, yeah, you're gonna experience it.
And so, yeah, I don't really have too much else to say. I think we kind of covered.
No, I think we covered the full framework essentially. Like, hey, take this, try it out yourself. If you're still having issues, that's where we come in. But you
Yeah.
can take the framework and apply it yourself, and hopefully get back to where you need to be performance wise.
Mm-hmm. Understand that, you will get better if you want to get better. I think that's really important. Lots of times people over catastrophize things and they never get better. They have a negative mindset. They're not positive, expectation bias. And as frustrating as the rehabilitation process is, if you really care about this, you'll put in the work, you'll put in the time, you'll put in the effort to get to your goals, and return back to doing what you love and pain-free living, whatever. So I guess I just wanted to close this out with anything else, any closing remarks that Kevin really has, and specifics on like, who does he recommend this service for, like, context, and I guess, like, yeah, anything else. Yeah.
Yeah. I mean, I think we covered most things. Last thing I'll just end with is yeah, like, as far as like good fits and everything for like what we offer and like our services, like obviously pretty much everyone listening to this kind of fits the bill of who we specialize in, which is either athletes that participate in a barbell sport like powerlifting, Olympic weightlifting, CrossFit, etc., or are just serious trainees in a gym and lifting atmosphere, aka everyone listening to this podcast right now.
That's because, let's be honest, you're not listening to this podcast if you're not into this.
Yeah, if you're not into lifting or the gym, there's no way you're listening to this podcast unless
you're at this point.
Yeah, yeah. So basically, every single person listening to this podcast fits the bill in what we specialize in, and our select clientele that I like to serve and that our company likes to serve. So if you're listening to this and you are a client of Adam's and you would like to schedule consultations to have this service, well, like Adam mentioned at the start of this podcast, that is a service and offering that we offer. So you are more than welcome to schedule with me. You can reach out to Adam directly, and then he will get you set up with me, and then I'll take it from there. And then if you're not a client of Adams, why are you not a client of Adams? Go sign up and be a client of Adams so you can get this service.
Yeah.
And if you're not currently though, and you do want just rehab stuff, you can shoot me a message. .kevfit on Instagram. It'll be linked down in the show notes, and then we can get you set up from there. It'll obviously not be a complimentary service because you are not a client of Adams, but you will still be able to get a consult from me. It'll just not be a complimentary service, and we can sort that out. But that's everything I got.
Awesome. Well, thank you guys for listening. I'll have all the details down in the show notes below. If you guys have any questions, just feel free to reach out to either Kevin or I. We'll try to point you in the right direction. And we're not opposed to giving free generalized help. If you do want more specialized help, that's where this comes in. And so yeah, thank you guys so much for listening. And I guess I'll talk to you guys in the next episode with Lyle McDonald. So get ready for that one. It's gonna be juicy.